Let's discuss window of heaven points. LI18 support the prominence. Location on the lateral aspect of the neck at the level of the laryngeal prominence between the two heads of the sternocleidomastoid muscle. How to find from the laryngeal prominence tip of the Adam's apple, draw a line across the sternocleidomastoid muscle to its posterior border. LI18 is located between the two heads of this muscle, which becomes more visible and palpable by rotating the head to the opposite side. Located on the same level are stomach 9 on the anterior border and SI16 on the posterior border of the sternocleidomastoid muscle. Needling, rotate the head back to its normal position before inserting the needle. Vertically 0.3 to 0.5 tune or obliquely up to 0.8 tune. Caution, carotid artery, jugular vein. Actions, indications, it benefits the thorax and larynx. Special features, LI18 window of heaven point, often used when swallowing is difficult, for example, after a stroke. LI18 is widely used as a local point for the throat problems, such as tonsillitis, mumps, laryngitis, aphasia, hoarse voice. This is also an important local point for nodules in these areas, such as nodules on the vocal cords and goiter. It is also a local point for thyroid problems. The ascending and descending of qi to and from the head. Its action in relieving cough, wheezing, and breathlessness is related to its being a window of heaven point. That is, subduing rebellious qi in the throat and regulating the ascending and descending of qi to and from the head. The explanation of acupuncture points says that LI18 is used for rebellious qi. The protuberance to which the point's name refers is the hyoid bone, the Adam's apple. It is important local point for the throat and voice problems, important local point for goiter and thyroid problems. In chapter 21 of the spiritual pivot, LI18 is included in a list of 5 points known as window of heavens, literally 5 regions of the window of heaven points. This passage states sudden loss of voice with obstructed qi in the throat. Choose LI18 and bleed the root of the tongue. LI18 shares certain important characteristics of this grouping in that it treats goiter and scrofula due to stagnation of qi and phlegm in the pivotal neck region, and sudden loss of voice, capping, and wheezing due to inversion qi. In clinical practice, LI18 is frequently used as an alternative to or in combination with stomach 9 in the treatment of difficulty in swallowing, especially following wind stroke, and chronic disorders of the vocal cords. The neck is the bridge to our head, the home of our senses, and the heavenly part of the body. This bridge needs to be unobstructed. There needs to be free flow for change and evolution to occur. In the same way that this point supports the local physical structure of the laryngeal prominence, it supports and assists the mind and spirit so that the large intestine can release at this level and see afresh. All windows of the sky brighten the sense organs in the head. Our senses are the way we receive and interact with the world, and this point can revitalize our view of life. It can support and strengthen one's ability to let go from difficult or painful circumstances and allow new vistas and perspective to unfold. When combined with LI4, these effects are further enhanced. This point is important for the free expression of lung and large intestine qi, which make connections or bridges in relationships and allows letting go at endings. If the poor has been so afflicted by the sadness and grief that the heart and lungs have become constricted, then the natural condensing of lung qi becomes oppressive, and in turn this impacts on the large intestine. In its role as a propagator of the correct way to live, while synchronized with the natural rhythm of life, large intestine needs heavenly qi to give it the impetus to carry out its role and so enable a new cycle of experience. The lung and large intestine need sufficient sense of connection with the qi of heaven and the processes of life, that letting go will not cause anxiety or a feeling of deprivation, that know the cycle of life and inspiration will continue. A healthy large intestine official enables us to move forward with our life while retaining what is of value from the past. Support and rush out is a helpful point when a person is mired in loss, disconnection, and isolation, possibly moldering in toxicity and resentment in the past. They can see the next step to take. Toxicity distorts communication and comprehension and leads to misunderstanding. This point allows clarity and movement into the situation and helps bring balance to body, mind, and spirit. At the physical level, it benefits the throat. It's used frequently for throat problems, whether infectious such as mumps, tonsillitis, laryngitis, phlegm-related problems such as nodules or goiter, or in need of lubrication, hoarseness, and difficulty swallowing. Also, when there is rashes from ache, acne, or boils on the throat, this point can be used locally. It relieves cough, dissolves phlegm, and disperses masses.